Medical Assistant Practice Test. Question 1. Of the following structures, which would be located in the mediastinum? Occipital lobe, aorta, left carotid artery, pancreas. The mediastinum is the central area of the thoracic cavity. It includes the heart, trachea, esophagus, thymus, and other parts of the central chest. The aorta is the main artery of the circulatory system and starts at the top left ventricle of the heart. The occipital lobe is in the brain, the left carotid artery is in the neck, and the pancreas is in the abdomen. Question 2. The point at which an impulse is transmitted from one neuron to another is nerve center, synapse, dendrite, terminal plate. The synapse would be considered the point at which an impulse is transmitted from one neuron to another. This is a small gap that exists between the neurons. The nerve center is where there is a group of nerves connected to each other. The neuron consists of projections referred to as axons and dendrites. The dendrite works by bringing information to the neuron. The axons take information away from the neuron. At the terminal plate is where an impulse travels from the neuron to the muscle. Question 3. Which of the following terms is spelled incorrectly? Bacterial, bacteriology, bactericidal, bacterium. Bacteriology is spelled incorrectly. It should be bacteriology instead. Bacterial, bactericidal, and bacterium are spelled correctly. Question 4. In a human, urine flows through the urinary system in which order? Bladder, urethra, kidney, urethral meatus, ureter. Bladder, kidney, ureter, urethra, urethral meatus. Kidney, ureter, bladder, urethra, urethral meatus. Urethra, bladder, ureter, kidney, urethral meatus. In a human, the urine flows through the kidneys, ureter, bladder, urethra, and urethra meatus. Remember, the urine is formed in the kidneys, so the chain starts there. The urine then travels down the ureters to the bladder and then out of the bladder via the urethra and the urethra meatus. Question 5. Which bone is found superior to the patella and inferior to the ischium? Calcaneus, femur, ulna, tibia. The femur is found superior to the patella and inferior to the ischium. This is the upper leg long bone that extends inferior from the ischium and superior to the patella. Question 6. Which abdominal region lies just distal to the sternum? Epigastric, umbilical, lumbar, hypogastric. The abdominal region that is distal to the sternum would be the epigastric region. There are 9 abdominal regions. Question 7. Blood flows from the heart's right ventricle into the left ventricle, right atrium, pulmonary artery, pulmonary vein. The blood flows from the right ventricle of the heart to the pulmonary artery. This is the only time in the body that an artery carries blood that has been used and is deoxygenate. Question 8. Which of the following terms is spelled correctly? Gastrointestinal, 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 gastrointestinal. The gastrointestinal tract consists of the mouth, esophagus, stomach, and then the intestines. It consists of taking food in, digesting it, and expelling it. Question 9. Gas exchange in the lungs occurs in one-celled air sacs called alveoli, bronchi, capillaries, pleurae. The alveoli is a one-celled air sac in the lungs where the air exchange takes place. The bronchi are the 2 large air passages that lead from the lungs to the trachea. The capillaries are the smallest blood vessels in the body. These carry blood from the arterioles to the venules. The double-layer membrane which separates the lungs from the chest wall would be the pleura. Question 10. If a patient has rhinorrhea as a symptom, this means which of the following? Mucus discharge from the nose. B. Excessive tearing from the eyes. C. Question 11. What is adipose tissue in the body? The outer layer of the skin. B. The whites of the eye. C. Question 12. Which of the following would be indicated if a patient came in with arthralgia, trouble swallowing, B. Joint pain, C. Question 13. Which of the following would be considered a part of the large intestine? Ileum, transverse colon, duodenum, jejunum. The transverse colon is part of the large intestines, along with the ascending colon and descending colon. The large intestine is considered to be the colon, which also includes the sigmoid colon and the rectum. The small intestines consist of the ileum, duodenum, and the jejunum. The length of the small intestines can vary from 32 feet to 34 feet. Question 14. Adipose tissue is made of fat cells, lymph nodes, muscles, skin. A person's adipose tissue is made up of fat cells. These fat cells are referred to as adipocytes. They synthesize and contain large globules of fat. These are mainly found under the skin, but can also be between the muscles. Question 15. The prefix brady, as in bradycardia, means fast, irregular, slow, without. The prefix brady means slow. It is used in terms such as bradycardia, meaning an abnormally slow heart rate. The prefix for fast would be tachy. Question 16. Of the following, which would a certified medical assistant typically be able to perform when assisting the physician in the exam room? Assist with minor procedures. B. Start and for therapy. C. Question 17. When washing hands, the three most important factors include antibacterial soap, length of time spent in hot water, friction, soap and warm running water, position of the hands, friction and water temperature, length of time spent, type of soap, and running water. Washing hands in a healthcare facility is considered the most important step in the prevention of spreading infections. This should be done before touching a patient and when leaving the patient's room and anytime the hands are considered soiled. Question 18. In a healthcare facility, which of the following agencies or organizations work to set the standards for the safety of the employees? OSHA, B. NLN, C. Question 19. When a clinic writes a statement which sets the level of care that is to be provided, it would be considered which of the following? Mission, B. Standard, C. Question 20. In order for the healthcare facility to comply with the Health Insurance Portability and Accountability Act, HIPAA, each patient is to be given which of the following? A list of the employees and their credentials. B. The staff's work schedule. C. Question 21. Typically, in an outpatient situation, which of the following is the main reason for the visit shown in the admission record sheet? The first listed diagnosis. B. The principal diagnosis. C. Question 22. Before making rounds, a medical assistant should be sure that they are carrying which of the following on their person? A pen. B. The syringe. C. Question 23. When would Korokov sounds be evaluated? Determining blood pressure, counting respirations, evaluating pulse, performing ultrasonography. The Korokov sound is evaluated when determining the patient's blood pressure. This sound is heard by using a sphygmomanometer and stethoscope when taking the patient's blood pressure. It is heard over an artery if the pressure is reduced below the systolic arterial pressure. It is not heard when counting respirations, taking a pulse, or when performing an ultrasonography. Question 24. For a medical assistant, which aspect of an exam room practice precedes the other listed techniques? Treating. B. Listening. C. Question 25. Which of the following is important for the medical assistant to do before and after contact with the patient? Record their interaction. B. Ask the patient questions. C. Question 26. If an infection is nosocomial, it means which of the following? Contracted within the hospital. B. Originates outside of the body. C. Question 27. When pathogenic organisms are killed or destroyed, it is called which of the following terms? Asepsis. B. Disinfection. C. Question 28. If a patient is tested to determine the antibiotics that a pathogen is susceptible to, what type of test is being conducted? Sensitivity, biopsy, culture, cytology. If the aim of testing is to determine if a pathogen is susceptible to an antibiotic, it would be considered a sensitivity test. The test to determine the pathogen would be considered the culture itself. The physician's order is typically written for a culture and sensitivity testing. If the physician removes a piece of tissue from the patient to send to be tested, it would be considered a biopsy sample. When the cells are analyzed to determine abnormalities, it is considered cytology. Question 29. A female patient comes into the clinic presenting with pain in the abdomen. The doctor notes that this could be dysmenorrhea. Which of the following best describes this diagnosis? Painful menstruation. B. Fluid-filled sac on the ovary. C. Question 30. A patient comes into your clinic and is having difficulty breathing unless they are in an upright position. Which of the following is the proper medical term for this condition? Menarche. B. Lithiasis. C. Question 31. If a man comes into the clinic and the doctor observes that he has gynecomastia, it would point to which of the following? Swollen glands in the neck. B. Overdevelopment of breast tissue. C. Question 32. Which of the following should a medical assistant do while the patient is explaining their symptoms? Make eye contact and listen. B. Avoid eye contact and listen. C. Question 33. If a paper medical record needs to be corrected, which of the following would be an acceptable way to make the correction? Erase the portion of note that needs to be corrected. Draw one line through the portion of the note that needs to be corrected and initial it. Use whiteout on the incorrect entry. Shred that page of the chart. If a correction is needed on a patient's paper chart, a single line needs to be made through the incorrect portion and then the person making the correction needs to date, time, and initial it. The correction is typically made above the incorrect portion. Information on a patient's paper chart should never be erased and whiteout is never used. The page would not be shredded. Patient charts should not be destroyed. Question 34. Making a note in one file that a paper is in another file is called underscore 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 underscore. Cross-filing, indexing, conditioning, cross-reference. Making a knot in one file that a paper is in another file is called cross-reference. This is actually a simple system, but is very helpful to clear up where a specific document can be found. Cross-filing is a term that is used most often in politics, referring to the registering of a candidate in more than one political party. Indexing would be making a list of a certain group of things. Conditioning would be the completion of the records. Question 35. Which of the following abbreviations refer to intracranial pressure that might be seen documented in a patient's chart? FACE. B. DFMLA. C. Question 36. Computer underscore 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 is considered the computer's physical equipment. Hardware. B. Boot. C. Question 37. If a medical record is problem-oriented, POMR, this means that each medical condition is assigned which of the following? Letters. B. Numbers. C. Question 38. Which of the following would describe a medical record that is categorized by date and time? Alphabetical. B. Numerical. C. Question 39. Which of the following would EMR refer to? Emergency magnetic resonance. B. Emergency medical records. C. Question 40. Word processing software may be used by a medical assistant to create which of the following? Superbills. Record of all patients and their addresses. Inventory of office supplies. Transcriptions. Word processing software can be used by a medical assistant to create transcriptions. Word processing software typically is used with text documents. This would include the creation of a document, editing of a document, and printing of a document. Question 41. A cystoscope is most commonly used by a specialist in endocrinology, urology, gynecology, gastroenterology. A cystoscope is most commonly used by a specialist in the field of urology. This is a thin tube with a light on the end of it that the specialist uses to check the urethra and bladder of the patient. The endocrinologist uses an endoscope. The gynecologist typically uses a speculum. A gastroenterologist uses a colonoscope. Question 42. Which of the following would be used to indicate someone has taken a file from the file cabinet? Patient chart, outguide, tickler file, summary form. The outguide is used to indicate when a person takes a file from the file cabinet. This is a filing system that some healthcare facilities use to help identify and control files/X-rays that have been removed. The removal could be documented in the patient chart or summary form, but this would not be a good system for the tracking of files. The tickler file is a system that helps remind the staff to do something at a future date. Question 43. Before referring a patient to another facility, a medical assistant should be sure to verify the patient's address, income, insurance, transportation. A medical assistant would need to verify the patient's insurance before transferring the patient to another facility. It is not in the scope of procedure of a medical assistant to verify the income of a patient. A home address check may be done, but this is typically done when the patient arrives at the medical facility. The medical assistant will more than likely check how the patient is going to get to the other facility, but the first thing to verify would be their insurance. Question 44. A client would not be billed in which of the following situations? Where workers' compensation covers the injury and care. Where the patient has Blue Cross. Where the patient has no insurance. Where there's an indemnity insurance plan. If the client is being seen for a workers' compensation injury, then the patient would not receive a bill. This bill should be sent to the workers' compensation department. If the patient has Blue Cross insurance, no insurance, or indemnity insurance, they would receive a bill. Question 45. A__________ must typically be paid by the patient at each visit when services are rendered at a doctor's office. Copay. B. Premium. C. Question 46. When billing for ambulatory care, it would indicate which of the following? Use of an ambulance emergency service. B. The assignment of benefits. C. Question 47. If a patient has end-stage renal disease, which of the following acronyms would be used when coding? NSTRD. B. DSRD. C. Question 48. A pregnant patient's medical chart states air 150 bpm. What does this indicate? Electronic health record. B. Embryonic hereditary range. C. Question 49. Of the following, which would not be considered to be a part of effective communication? Message, noise, sender, feedback. Noise is not considered a part of communication. The parts of communication would include content, message, sender, how message was sent, receiver, and feedback. Question 50. Which of the following is the center of the brain that controls fear, aggression, and anxiety? Amygdala. B. Cortex. C. Question 51. Maslow's hierarchy of needs includes which of the following? Money, direction, self-loathing, self-esteem. Esteem is considered to be one of the 5 levels of Maslow's hierarchy of needs. The other 4 would include self-actualization, self-esteem, safety, and food and sleep, physiological. Question 52. If a patient acts extremely rude to a medical assistant because their insurance does not cover their visit to the clinic, it would be considered which of the following? Displacement, denial, compensation, sublimation. Displacement is when a person transfers emotions about themselves or their situation onto an external substitute, like slamming a door when angry, or, in this case, acting rude to a medical assistant. It is an unconscious defense mechanism. Denial would be considered when the patient does not believe reality. For example, if they are told they have cancer but continue to believe something else is causing their symptoms. Compensation would be when a person overemphasizes a behavior such as providing their child with gifts because they have to work and cannot spend enough time with them. Sublimation is also a defense mechanism, but it involves taking a negative emotion and turning them into positive action. For example, if a person is turned down from a job and is inspired to start their own business. Question 53. When a medical assistant is able to listen to a speaker's problem and understand the speaker's personal point of view, it is called nonverbal communication. B. Critical listening. C. Question 54. When someone listens for particular things and blocks out what they do not want to hear. Full listening. B. Selective listening. C. Question 55. Which cranial nerve is related to the sense of smell? Hypoglossal, olfactory, trochlear, vagus. The cranial nerve that is related to the sense of smell would be the olfactory nerve, which is cranial nerve 1 or CN1. The 12th cranial nerve is the hypoglossal, which controls the person's tongue movement. The 4th cranial nerve is the trochlear, which controls the superior oblique muscle of the eye. The 10th cranial nerve is the vagus, which interfaces with the parasympathetic control of the lungs, heart, and digestive tract. Question 56. A medical procedure cannot be performed on a patient until the doctor obtains underscore 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 confidentiality, informed consent, insurance authorization, vital statistics. An informed consent should be obtained prior to a medical procedure being performed by the physician. If this consent is not obtained, the procedure could legally be considered assault and battery. The physician is the person that is ultimately responsible for obtaining the informed consent and should always follow the policies and procedures of the facility when obtaining this consent. Confidentiality should always be observed with any patient, but is not something that would need to be obtained prior to a medical procedure. According to the insurance company, prior authorization may be needed for the procedure, but would not stop the procedure from being done. Vital statistics are not always necessary prior to a procedure being performed. It would be according to which procedure is being performed. Question 57. A medical assistant is at a bar with her close friend and they get to talking about work. The medical assistant informs her friend that the friend's teacher was in the doctor's office getting checked out for kidney stones. This would be considered which of the following? Breach of confidentiality, assault and battery, professional malpractice, slander and defamation. According to the HIPAA, Health Insurance Portability and Accountability Act, which was put into law in 1996, the medical assistant is not allowed to discuss any patient with her friend, much less in a public setting where other people can also hear the conversation. This is a federal law which is taken very seriously, with fines and even possible jail time can be imposed as a result. Assault and battery is when one person touches another with the intent of harm. Professional malpractice would be when there is a failure of the professional to exercise the ordinary professional skill expected, which results in damage or injury to the patient. Slander and defamation would be when a person makes a false and damaging statement about another person. Question 58. Of the following, which would the HIPAA requirements apply to in a healthcare facility? Physicians, nurses, certified nurse aides, all of the above. HIPAA stands for the Health Insurance Portability and Accountability Act. This is a federal law that was put into effect in 1996. This law applies to physicians, nurses, and certified nurse aides, along with the other employees that work at the healthcare facility. Question 59. A 17-year-old woman who is married arrives at the emergency department of a hospital with an injured arm. Who must consent to any treatment since this patient is a minor? Spouse and minor. Parent, patient. The parent and the patient. If the 17-year-old woman is married, she would be considered emancipated. In this case, the patient would be able to give consent herself. Question 60. If a medical assistant touches a patient with the intention of harming them, it would be considered which of the following? Malpractice. B. Battery. C. Question 61. If a clinic charges a patient's insurance for treatments that were not done, it would be considered which of the following? Malpractice. B. Fraud. C. Question 62. If a medical assistant is underscore 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 underscore, it means that the medical assistant performs her duties in compliance with the standards of her job description. Dependable. B. Negligent. C. Question 63. When hiring a new employee, which of the following forms is needed when they are choosing tax exemptions? I-9. B. 1099. C. Question 64. If a patient's bill has been unpaid for more than 90 days, which of the following would call the patient? Attorney, medical assistant, collection agency, physician. Once the patient's bill reaches 90 days or more overdue, it should be turned over to a collection agency to contact the patient. The breakdown for the schedule to address unpaid bills would consist of: bill patient 30 days, call the patient about the bill 45 days, send letter number 1 to the patient 60 days, send letter number 2 to the patient and make a call to them 75 days, send letter number 3 80 days should turn the bill over to a collection agency. 90 days. At 90 days, the collection agency should contact the person, not the lawyer, medical assistant, or physician. Question 65. If a medical assistant managing patient payments learns that a patient's check has been returned due to insufficient funds, what step should the medical assistant take first? Call the patient, call the police, notify the collection agency, call the patient's employer. If a clinic gets a check is returned for lack of funds, a medical assistant's first action should be to call the person that wrote the check. At some point, if the check is not taken care of, the collections agency or police may need to be called, but it's not the first step. Question 66. What financial record in a clinic is typically the most active? Accounts payable. B. Employee payroll. C. Question 67. Good team members underscore 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 focus on their tasks and not on some lofty goal. Do not communicate with or interfere with others. Do their job well without helping others with theirs. Accept responsibility and accountability. Good team members accept responsibility and accountability. They are clear about the goal, S, and they know that all goals are important. They focus on the goals. Good team members are always ready, willing and able to help other members of the team, within their scope of practice. They also communicate with other team members and they trust them. Question 68. Once an employee is hired, within how many days does the employer have by federal law to have the I-9 form completed and verified? 30 business days. B. 14 business days. C. Question 69. When checking the identity of a patient, most healthcare facilities require that the patient present __ forms of identification. 3. B. 1. C. Question 70. If an individual is going to be using a computer for long periods of time, they should do which of the following? Adjust the chair height and monitor to a comfortable position. B. Sit as long as you can without moving so you do not break concentration. C. About once an hour, stand and stretch. Question 71. A patient is always late for their scheduled appointments. The office manager spoke to the patient about the issue, but it has not changed the patient's behavior. Which of the following is an appropriate next step? Always schedule them at the end of the day. B. Charge them a late fee. C. Question 72. What type of booking or scheduling is used if a medical assistant brings multiple patients into the office at the top an hour to see their health care professional and they are seen on a first-come, first-served basis? Double booking. B. Wave scheduling. C. Question 73. Call screening in a medical office is important because it allows a medical assistant to do which of the following? Avoid taking walk-ins. B. Avoid patients that are not emergency. C. Question 74. As a medical assistant, when a patient calls to cancel an appointment, you should do which of the following? Have the doctor call them to reschedule the appointment. B. Inform them that their appointment cannot be rescheduled. C. Question 75. Which of the following treats a patient that has diseases of the blood? Cardiologist, pulmonologist, podiatrist, hematologist. A hematologist treats patients that have diseases of the blood such as hemophilia, leukemia, or sickle cell disease. A cardiologist treats diseases of the heart and vascular system. A pulmonologist treats diseases of the lungs, and a podiatrist treats the feet. Question 76. Calcium, potassium, and sodium are all classified as androgens, electrolytes, estrogens, prostaglandins. Calcium, potassium, and sodium would be classified as electrolytes. There are several others which could include, for example, glucose, ammonia, and magnesium chloride. Androgens would be considered steroid hormones that help with male secondary sex characteristics. Estrogens are a group of sex hormones that play a major role in the sexual/reproductive development, especially with women. Prostaglandins are a natural chemical in the body that has hormone-like qualities. Question 77. Which is the term for an abnormally low white blood cell count? Anemia, leukemia, leukocytosis, leukopenia. The abnormal low white blood cell count would be considered leukopenia. If a person has a normal white blood count, it would be between 3,500 and 11,000 per microliter. When this count drops to less than 3.500 per microliter, it can be considered leukopenia. If the red blood cells are low, it is considered anemia. Leukemia is mostly a childhood condition, but it can also be in adults, with more in men than women. It is also more prevalent in whites than African Americans. Leukocytosis is when there is an abnormal high amount of white blood cells in the body. This condition is common with an infection or inflammatory process. Question 78. In the periodic table, K is the symbol for calcium, iodine, phosphorus, potassium. In the periodic table, K would be the symbol for potassium. The other answer options are as follows in the periodic table: calcium Ca, iodine I, phosphorus P. Question 79. Which blood type would be considered the universal donor? AB, O+, O-, B. The universal donor blood type would be O-. This blood type can be administered to patients with other blood types if there is an emergency and there is no time to type and cross-match the patient. The 8 blood types consist of A+, A-, AB+, AB-, B+, B-, O+, and O-. Question 80. Underscore 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 is a protein in plasma which forms blood clots and stops excessive bleeding during tissue or vascular injury. Erythrocytes. B. Leukocytes. C. Reagent. D. Fibrinogen. Question 81. A condition of insufficient blood clotting cells is referred to as thrombocytopenia, thrombophlebitis, erythrocytes, erythrocytosis. Thrombocytopenia would be considered a condition as to where there is insufficient blood clotting of the cells. Thrombophlebitis would be considered an inflammation of a vein. Erythrocytes would be the red blood cells, and erythrocytosis would be an increase in the number of a person's red blood cells, polycythemia. Question 82. Of the following, which would be considered the first step in treating a patient with a chemical burn of the skin? Wash with soap and water. Apply an antiseptic ointment. Apply ice. Flush area with water. Flushing the area with cool water should be the first step in the treatment of a patient with a chemical burn. The area should be washed with large amounts of water for at least 20 minutes. There are certain chemical agents that are not to be irrigated with water immediately, such as dry lime, phenols, and elemental metals such as magnesium or calcium oxide. The chemical burn area should not be coated with an antibiotic ointment, washed with soap and water, or have ice applied. Applying ice can cause a frostbite-like effect and cause even further damage. An oil-free moisturizer can be applied for 3 days, but soap is not typically applied to these types of burns. The patient might be placed on antibiotics as part of their treatment if the burns are bad, but the antibiotic ointment is not typically used. Question 83. If a patient has severe burns over more than half of the body and the burning process has been stopped, which of the following should be the next step in their treatment? Starting 4 antibiotics. B. Applying antibacterial ointment. C. Question 84. If a patient is admitted with a cut that is still bleeding, which of the following should be done first? Stitch wound. B. Apply antibiotic ointment. C. Question 85. If an elderly patient suddenly has an onset of confusion, with no previous disorders or symptoms, what would be the most likely explanation? Urinary tract infection. B. Dementia. C. Question 86. Which of the following symptoms would a patient exhibit that could be indicative of cerebral edema? Abdominal pain. B. Itching. C. Question 87. A paramedic informs the medical assistant that a patient has had a cardiac arrest. What does this mean? Irregular heartbeat, blood flow interference to the heart, variation in the rhythm of the heartbeat, sudden stoppage of the heartbeat. Cardiac arrest is when there is a sudden stoppage of the patient's heartbeat. This can be caused by a variety of causes such as a myocardial infarction or trauma. An irregular heartbeat could be a sinus arrhythmia or atrial fibrillation, among other causes. A blood flow interference to the heart could be caused by a blood clot or blockage in a coronary artery. Variations in the patient's rhythm of the heartbeat could be caused by several reasons. Question 88. The pharmaceutical abbreviation QID means underscore 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 dot. Every hour, every day, 4 times a day, every week. The pharmaceutical abbreviation QID means 4 times a day. Other abbreviations include Question 89. If medication has been ordered by a physician to be taken PC, it should be given before meals, at hours sleep, after meals, every 4 hours. After meals would be PC. Before meals would be AC. At hours sleep would be HS. Every 4 hours would be QID. Question 90. The pharmaceutical abbreviation BID means underscore 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 dot. Once a day, twice a day, once a week, twice a week. The pharmaceutical abbreviation BID means twice a day. Once a day is abbreviated to QD. This is not used in most facilities anymore because of the chance of misinterpretation. The term daily is what is typically used now. Once a week is usually Q weekly and twice a week would be twice weekly. Question 91. If medication of a patient or resident is indicated as PRN, it is given once a day. B. When necessary. C. Question 92. All of the following are narcotic or narcotic-like analgesics, except ibuprofen. B. Hydrocodone/APAP. C. Question 93. Which of the following classifications of medications would be helpful in treating the patient that is complaining of heartburn? Beta blockers. B. Antacids. C. Question 94. If a patient is prescribed a diabetic agent such as metformin, which of the following reactions should the patient expect to experience? An increase in their blood glucose level. B. A decrease in their blood pressure. C. Question 95. Of the following, which medication would typically be ordered to help a patient to get rid of excess fluid in their lungs? Furosemide. B. Erythromycin. C. Question 96. A patient is diagnosed with a blood clot in their left lower leg and is hospitalized. Which of the following would more than likely be prescribed for the patient per intravenous solution? Warfarin. B. Heparin. C. Question 97. Which of the following would be considered a muscle relaxant that might be ordered for a patient with back pain? Oxycodone/acetaminophen. B. Hexachlorophene. C. Question 98. If the physician prescribes a low-fat diet for a patient, which of the following should they be able to eat? Whole milk. B. Chicken with skin attached. C. Question 99. Of the following, which would be considered the correct percentage of nutrient intake by the Dietetic Association for a person's protein intake every 24 hours? 15%. B. 65%. C. Question 100. Of the following, which describes the body's ability to maintain its normal state? Anabolism, catabolism, metabolism, homeostasis. The ability of the person's body to maintain its normal state would be considered homeostasis. An example of this would be the body's ability to maintain its temperature. The constructive process in which molecules are turned from simpler to more complex ones is considered anabolism. The destructive process in which molecules are turned from complex to simpler molecules would be considered catabolism. In a person's body, metabolism would be the sum of the chemical processes and the physical processes, which includes anabolism and catabolism.